The first question was directed actually to Maria Gloria Dominguez Bello, but also to Manuel Funkhauser. And so the question is, once the genetic data is up on the web and accessible by anyone, how will you ensure that monetary benefits that may result from downstream usage of the data is fairly distributed?
So I could briefly answer. Again, it is a challenge. It's being a challenge to leverage and benefit the originary people of that were source of knowledge. I insist that because of the heterogeneity in legal protections, ethics should be put forward at all times. The world is becoming open publications, open data set, as it should be, in my opinion. And again, with open data sets, there is always the underlying obligation and moral commitment to recognize the sources. So I think the world is better open and free, access to journals and information. And then on the way, we need to work together to demand for ethical and responsible behaviors.
Anyone else want to comment? Okay, the next question is for Jack Gilbert. Can we improve the beneficial effects of drugs by preparing the microbiome of patients?
Well, by preparing them prior to drug administration, potentially. I mean, the obvious case for that is prodrugs, which are drugs that are deliberately designed to be manipulated by microbes to produce a beneficial effect. However, in many instances, and I think Manuel pointed this out, we know that if the microbiome is healthy, then a patient is going to have a better response to certain types of medication. A good example of that is with chemotherapy. We know that if we can boost immune system responses to be more effective, then chemotherapy and immunotherapies can be more effective in helping to treat cancers. And a lot of that has to do with altering microbiome responses. And several papers from 2016 and 2017 demonstrated that quite effectively in mouse and human studies. So, we know that there's an opportunity to manipulate the microbiome to facilitate better responses to drugs. The other side effect is, and I pointed this out with the surgical practice, is if the microbiome has the wrong elements in it, the bad actors, that can facilitate a negative outcome for non-drug related interventions such as surgery. And we're only just starting to understand the impact of that. Things like peripheral arterial disease, which can result from diseases such as diabetes and lead to amputations if you have critical limb ischemia, can be actually linked back to microbial translocation from the gut and the oral cavity into the lymph and blood system, leading to repositioning of those microbes in areas that are under physical duress. And that is predicated on the idea that poor oral hygiene and poor gastrointestinal microbiota can facilitate negative outcomes. And so understanding all of these multi-dimensional, multifactorial elements that go into patient care is important. We're not just treating the patient when they get into the hospital. We need to be treating the patient while they're at home, throughout their life. All of the aspects that go into making health need to be educated and provided to those people so that when they come into the hospital or the doctor's surgery for treatment, we can treat them effectively.
Thank you. Anyone else? Okay, the next question is for Matthew Ryan. And it is, cryoprecipitation is not an option for some countries. Are you developing other types of approaches?
At the moment, no, we are focusing on cryopreservation. It's long been established that it's the Rolls-Royce of methodologies for preserving microbes, but it's not without problems. We know that if you take a sample of microbes, they will all respond differently to the preservation stresses that you get through the freezing and thawing process. So with microbiomes, we've got to try and mitigate that, particularly the functionality, as much as possible. There are other methods we can look at. Drying is one of them. But again, freeze drying, if you're taking a consortia of microbes, not all the microbes in that particular consortia will tolerate the freeze drying process. This is a relatively new approach to cryopreservation and freeze drying. There will be methods, just as there has been in traditional culture collections, to answer these questions, but these will take a while to feed through. But it is a very exciting area of research.
This question is for Thomas Schmidt. The question is, they sell butyrate capsules. Are they known to be effective as anti-inflammatories?
Yeah, thanks. It's a good point to make. If butyrate is so useful to us as people, why not just consume butyrate? And I think the biggest reason is the continual production of butyrate by the gut microbiome is much different than consuming a tablet. And so, okay, possibly it would be a slow release tablet and one could mimic butyrate production that way. So I imagine that would be useful for some scenarios, but I always like to point out that if fermentation is being stimulated in the gut, it's not going to just be the fermentation end products that are made. There are over 200 metabolites that are also made and circulating in the bloodstream. And so I think that while we might target butyrate or a different short chain fatty acid, in the process of doing that, we're having hundreds of other metabolites made as well. So that would be worth considering when one's talking about supplementing just one of those compounds like butyrate.
Thank you.
Can I also just add that
butyrate
tastes like bile? It's a absolutely vile compound that is disgusting to smell and taste. So you really got to make sure it's tight in those capsules. If they break open, there's a horrible system to deal with.
Good point.
So this question was actually addressed to almost all of the panelists. And the question is, will the Microbiota Vault and CABI have the standard protocols available for local collections?
I think that's the plan, right? The goal is to develop the protocols and share them as broadly as possible.
Right, and I would add that, you know, we should work together with people that already have collections, have already done research, and continue expanding to optimize. This is going to change. You know, in 5 years, we may be preserving microbes differently. So we need to work together and inform each other and keep updated.
Tori Midvet, I know you weren't a speaker today, but we got a question for you, which is, can you comment on the Norwegian efforts?
The Norwegian efforts is going on, and the Norwegian government, the Department of Health, are very interested in just using the vault up at Svalbard just for collect and store for the future. And I will come back with information to you, to the rest of the panel, within some few days.
Thank you.
They have discovered the value in your efforts, in our efforts, to save the microbiota from different parts of the world just for the future. Yep.
Sorry, can I also add something to that? I'm
Please.
I'm very keen to see the Microbiota Vault extend beyond human samples as well. And I made this point to clearly in several publications we put out there. But as Rob and I and Janet Jansen founded the Earth Microbiome Project, and a number of people here have been involved in that study, including Tom and Marty and Nick. The opportunity to preserve the microbial biodiversity and functional potential in ecosystems that may need restoring, such as mangrove swamps or areas that are under desertification or coral atolls. The opportunity to preserve those and to weaponize them in our fight against our own destruction of the planet would be valuable. So there may be an opportunity to expand beyond just the collection of stool.
And I just want to add that that's why in the microbiota vault, we say microbes important for humankind, not medical microbes. So many other ecosystems will be important for humankind.
I agree with you, Maria Gloria.
The next question is for Thomas Schmidt. Do you think that if a fecal transplant was performed before the bone marrow transplantation, there would be less chance of graft versus host disease?
Yeah, it's a great suggestion, and it actually has been tried with mixed results. And I think the mixed results come from 2 points. One is that people coming in for the bone marrow surgery are consuming multiple antibiotics, and they're broad spectrum antibiotics. So the microbes that are already under assault there. The second point that I'd like to make is that in addition to just seeding the gut, I suspect that it would be more effective if the fibers were then provided that would fuel the gut. So it's not just providing the correct organisms, it's making sure that the environment is suitable for them to thrive. So great suggestion for a fecal transplant. Have to consider the antibiotic use that is part of the protocol, and also consider the possibility of feeding those gut microbes once they're in place.
Thank you. Okay, we have time for one more question, and I'm going to kind of paraphrase a little bit here and combine a few questions that have to do with COVID-19. I'll start with the written question, which is, we learned yesterday that the first 2 years of life are crucial for developing a healthy microbiome. Due to the COVID-19 pandemic, newborns are growing up rather isolated in the Western world, and will that have an effect on the microbiome? And I think added to that, I'd like the panelists to comment on anything else about COVID-19 that may be influencing the microbiome. And in particular, there was a question specifically about ivermectin for COVID-19, which is being used rather extensively in Peru and elsewhere, and if there are any opinions about that and its effect on the microbiome. So I'll open it up to anyone who wants to comment.
I wonder if I can plunge in, since this is of interest to me in several regards. COVID-19 is mostly bad news, but there's some good news, and that is that at least in the United States, where it's been studied, and probably all over the world, antibiotic use is down across the population. It's probably down because people aren't going to the doctor as much. Because of social isolation, there's less respiratory viruses and infectious diseases, and many of these individuals, including children, are getting antibiotics for viral infections. We know this. So it could be that this could be a period of recovery with the microbiome for different populations. Obviously, people in the hospital with COVID-19 have been getting a lot of antibiotics, but that's a smaller segment of the population.
And I'd like to add to that. I get asked this question a lot, because we do a lot of built environment microbiome work, right? And and along with Maria Gloria and Marty and Rob, we've been making this preposition that early life exposures are incredibly important for a child's health, but that can be very easily mitigated. Doesn't really matter how sterile your home is, as long as you've got some dogs maybe in there and the kid gets out and plays in the dirt reasonably regularly, maybe interacts with other farm, maybe goes on a few walks into nature. And so whenever somebody from the media asks me that question, I say, well, furry pets, a few nice walks and maybe a little bit of gardening would protect those kids against all of the extra cleaning and lack of exposures associated with COVID-19 precautions. So I don't think that's really an issue. But we do really have some exciting work that's coming out of work that Rob and I had done in the hospitals at UCSD, a work at St. Jude's University over in Tennessee, St. Jude's Hospital in Tennessee, and studies ongoing with some fantastic computational modelers at UCSD, where we've identified that, like flu, the COVID-19 virus can stick to the outside of certain bacteria, and that can actually promote the survival of the virus outside of the body. Now, we still have a long way to prove that and demonstrate how it actually, what role it actually plays in transmission. But in flu, it plays a very significant role in transmission and in co-associated infections during flu disease. So we're very excited about the potential of that work to help us to further understand that epidemiology.
I may add to this that COVID-19 had more or less reduced very much the fecal transplantation. As you are aware of in the state, Food and Drug recommend that you should not do it. You have to take care of, so you have to investigate presence of the viruses in your fecal transplant. Yes.
Interesting.
So therefore it will be a demand. It will be a lot of patients in the future that do need to have a fecal transplantation when it's more, when the COVID-19 have passed away.
Thank
Maybe
you.
just something to add as a single center observation, which goes in line with what Dr. Blaser just said. I mean, in my city, actually, we recognize that there are far less multi-drug resistant bacteria in traveler returners because basically there's no traveling anymore. And that's also interesting to see. I'm wondering if also others observe that in their centers.
Mm-hmm.
Any other comments? Okay, well, with that, I'd like to thank all of today's panelists for a truly terrific discussion today. And thank you to all the panelists for over the past 3 days for a great conference. At this point, I would like to turn things over to our Peruvian hosts, Deborah Delgado Pugle and Pablo Tsukayama, to give us a few closing words.
Right. Hello from Lima. I'll go first. Deborah will follow. Thank you all for all these 3 days of very interesting, cool talks. On behalf of my university, Cayetano Heredia in Lima, we are very happy and excited to be part of this symposium and to see the start of this large collaborative project. Very exciting to see a great lineup of speakers representing a very wide array of expertise and disciplines. Also, on the public side, on the attendees, very interesting to see a very diverse set of students, scientists, and professionals from all over Latin America and all over the world. More on a personal note, it is very exciting to see work and new work of colleagues and scientists whose work I have followed for a very long time since I was a student. I was remembering back in 2012 when I was a grad student, I was I was in charge of setting up 16S studies and we used Shine 1.4. And so that feels very, very long time ago. So it is very exciting to see how the field has advanced in a few years, and always great to see updates on that, new technologies and methods being developed at every level. So some key points to recapitulate is, well, of course, microbiota is very critical for optimal health. It is very dynamic, can be influenced by diet, lifestyle changes, environment, interactions, and others. Also interesting to see the role of infectious diseases and antibiotics on that. And the need to preserve these communities has become very clear over the past few days. We're also seeing a lot of new analysis, also culturing methods. So it will be interesting to see how much we can study some of these organisms as part of communities, but also as part of unique cultures in the lab. So a few challenges ahead, now that we've been talking about this, and of course, Deborah will elaborate on this more, but accessing very vulnerable populations is going to be a key issue, right? And how to ensure their welfare, that things are communicated clearly, and the goals of all these are made very clear from the beginning. More on the logistics side of it, collecting stool samples in very remote places where it will take teams many days to get there, and how to transport samples back safely to the laboratories. And once they're in the local labs, if we're talking about local collections, is how do we ensure the preservation of these collections with limited resources and infrastructure that are available in these satellite sites. Standardizing methods for culture, for processing, analysis, sequences, and how to make these future-proof should be an interesting challenge. And now talking about opportunities is that, at least from Peru, and this notion that being a very biodiverse nation, we have to be committed to this preservation and global cooperative efforts. So we have to promote the issue of preservation and respect for indigenous peoples, and promote also North-South collaborations, but also South-South collaborations to take advantage of all these on many different areas. Also, what I've seen since returning to Peru is that this topic in particular of the microbiota and advances in genomics and bioinformatics, it is very appealing to young scientists everywhere. So this should be a nice, interesting opportunity to promote the training and bringing new talent into the field. And finally, the need to build regional efforts like Latinbiota that Gregorio mentioned, and many others, and to work together with more regional actors to promote these issues in our countries. So that's all from my side. Very much looking forward to new and exciting collaborations, and thank you very much from Lima.
Thank you, Pablo. Hi, everybody. I would like to thank you very sincerely for these 3 days of a lot of learning and ways forward to collaborate. I would like to thank especially Gloria and Jorge for bringing this project to Peru, and Beth and Marcelo for holding these 3 days and making it go so smoothly and fine. I really enjoyed all the presentations, and I think this is it has been a wonderful experience of knowledge sharing and collaboration. I also welcome very much the ambition of building political will. We started these 3 days with the participation of the Vice Minister of Strategic Natural Resource Use here in Peru. And I know that they are very keen in engaging and playing leadership role at a multilateral level and at the national level as well. So I'm pretty optimistic about the role Peru can play to preserve microbial biodiversity, as it has played a role before. And this ambition, we know it's complex, but at the same time, we have experience and we have the capital and the values to to guide us on this effort. I'm convinced that the Biota Vault can play an important role for future generations, and particularly considering vulnerable populations. And for Peru, this is a big challenge, and we are very very aware about it. So working ethically towards it is going to be like our goal, I think. And from our collection practices to exploitation, this is going to be a key axe. And the involvement of different stakeholders can't be stressed more. As we talked about yesterday, civil society here is pretty engaged in these kind of issues. Indigenous peoples have organizations and do understand what is at stake. And we're very happy that we can start from the very beginning, engaging them and explaining this and what is at stake. Using science to promote indigenous people's rights and human rights as a whole, it's a very important agenda, and we will continue to collaborate in everything that is necessary to improve well-being and keep the resources that are important for our future. So thank you very much for putting all this together, and we look forward to keep collaborating with you and learning from each other.
Thank you. And thanks to everybody, all of our audience members, all of our participants. Thank you to everybody, and enjoy the rest of what's left of the weekend.
Thank you, Beth and Marcelo.
Thank you. Thank you all.